There are modalities out there where they talk about this is the new thing, and new is supposed to mean better, and that's not necessarily always the case. And two modalities that you hear about, proton beam therapy and the Cyberknife. Sometimes I turn on the radio and I hear the Cyberknife Center putting down protons and the proton people putting down the people that use the Cyberknife. The fact is they're both right or both wrong depending on how you look at it. The reality of the situation is protons for the treatment of cancer, there's nothing really new about that. We've been using proton beam therapy for decades to treat tiny tumors in the eye, what we call retinoblastoma for children and babies, for small lesions in the brain and spinal cord. Protons have special properties. Proton beam therapy is another form of radiation therapy. The proton is a particle as opposed to external beam radiation therapy that's photon-based, which is typically used. The proton has special properties. You're able to deposit the radiation dose in a very discrete way to a very, very small volume, tiny volume, and spare surrounding normal tissues if it's administered with extreme accuracy. But what's happening now is there are a lot of old proton accelerators in the United States that are being tapped now for radiation treatment, and they're adapting them so that they could use protons to treat all forms of cancer, not just tiny little 5-millimeter tumors where you're trying to get a pinpoint dose virtually. So now they're using it to treat things that are much larger. They're using it for prostate cancer. They're using it to treat lymphomas. They're using it for large fields. And the problem is that the larger the field is, the more you lose the benefits of the proton beam therapy. Now, I know this is anecdotal, but I've seen patients and heard about patients that have experienced injuries having these proton beam treatments for prostate cancer, injuries of a sort that are far worse than anything I have ever heard of before. There's a lot of danger associated with giving proton therapy for larger, more irregular volumes. It's not the panacea they make it sound like. It's a dangerous technique potentially, can be efficacious in some areas, some very specific areas, but it's being used on a much more widespread basis where there are definitely serious risks involved. Which brings me now to Cyberknife. Cyberknife is a technique that uses hypofractionation, all right? It's a highly focused form of radiation therapy, but it's given in a hypofractionated manner. So if you undergo radiation therapy directed to the prostate with a Cyberknife, they do it in 5 treatments. So if your treatment is slightly off at all, you're into the patient's rectum or you're into the patient's bladder. So there's a much, much greater risk of causing a serious injury to the rectum or to the bladder. Plus, you're dealing with the effects of the extremely high dose rate on the urethra, which runs right through the prostate. They focus this thing, but if they're slightly off, you've got big problems in terms of normal tissue tolerance. You've got big problems in terms of effectiveness. It's all being blasted out in only 5 treatments. It's very, very dangerous, extremely dangerous.